The Speaker of the House of Representatives says the House is working on amending the National Health Act to address the gaps in access to health care, including funding for gunshot victims. The Speaker said this at the opening ceremony of the 44th, 45th Annual General and Scientific Meeting of the West African College of Physicians Nigerian Chapter with the theme Nigeria Health Industries, Challenges and Prospects in the Contemporary World in Abuja. Gbajabiamila was represented by the Chairman, House Committee on Health.
Within the next few days to come, we are also going to consider the amendment of National Health Act, which provides the basic framework upon which healthcare policy in the country is developed. So also, the House of Representatives is now waiting for concurrence from the executive, in which we have tried to address the issue of gunshot injuries. And you know there was a lacuna in the previous as practitioners. Source of funding or payment of services rendered to gunshot injuries has become a really serious matter. And therefore, no matter how that we have rejections, it's anticipated if you know you render services, you cannot. So in the amended act, we have tried for fast solution where practitioners can claim the bills of services rendered through to a gunshot victim. And we do believe with all this, Nigeria will be better.
The Minister of State for Health listed the cause of Nigeria's poor health indices.
Inadequate human resource for health. B, non-optimal supply chain management. C, poor data management, as well as limited funding to scale up coverage of evidence-based interventions. D, the urban-rural skilled distribution of skilled frontline health workers. E, the brain drain of skilled health workers to the Western world and some African countries. And F, COVID-19 pandemic that has further compounded the problems and challenges at hand. Some of the steps to address these challenges include, but not limited to, increased investment in terms of political will and leadership, provision of adequate funding, collaboration with the professional bodies, partners, and other stakeholders, as well as adherence to the next level health sector agenda of 2019 to 2023 of President Muhammadu Buhari.
The FCT Minister, Mr. Muhammad Bello, represented by the Acting Secretary for Health and the Executive Director, National Primary Healthcare Development Agency, represented by the Director, Primary Healthcare Systems Development of the agency, attended the ceremony. Others at the event include College of Physician President, represented by College of Physician Director of Grants, Nigeria Chapter, and Chief Medical Directors, among other stakeholders. The West African College of Physicians is a professional body of medical specialists, including doctors, physicians, and nurses within the West African region.